Hello everybody, my name is Emily Gutierrez. I hope everybody's having a good day so far. Today I'll be doing a presentation on lupus, also known as the great imitator. So what is lupus? Lupus is an autoimmune disease. What does this mean for patients with lupus? Well, it means that their immune system attacks healthy cells and tissues by mistake. Here is a short video explaining to you a little bit more about lupus.
Lupus affects over 5 million people worldwide. You may have heard of it. You may know someone with lupus. But what is lupus? Let's take a look. This person is healthy. Hello. Everybody has white blood cells. They protect people from infections. This is what stops you from getting ill. In people with lupus, however, the white blood cells aren't so helpful. The white blood cells are out of control. They won't just attack infections, they'll attack anything. This is what causes all their symptoms. Symptoms of lupus can include extreme fatigue, joint pain, muscle weakness, rashes, hair loss, and it can also damage organs such as the kidneys, heart, or brain. There are a few things that can trigger symptoms in lupus patients. One of them is the sunshine. About 60% of lupus patients are sun sensitive. Another trigger is stress. It is very important that lupus patients take good care of themselves physically and emotionally. At present, there is no cure for lupus, though it can often be managed through treatment. A big problem is that it takes an average of 7 years for somebody with lupus to get a diagnosis and receive this treatment.
Alrighty, on to our next slide.
Lupus affects.
Alrighty, so there are five types of lupus. The first one being systemic lupus erythematosus, which is the most common lupus. The symptoms can range from mild to severe, affecting many parts of the body. The second kind is discordal lupus, which causes a red rash that doesn't go away. There is also subacute cutaneous lupus, causes sores after being out in the sun. There is also drug-induced lupus caused by certain medications, but it usually goes away once the person stops taking the medication. There is also neonatal lupus, which is a rare condition, but is transferred from mother to son after birth, and they believe it is due to certain antibodies from the mother. Next, we'll be talking about symptoms. Like you've seen in the video, there are many symptoms, and there's not just one to pinpoint. That's why it takes so long to diagnose. But the basic ones are extreme fatigue, pain or swelling of the joints, butterfly rashes, sensitivity to sunlight and fluorescent lights, hair loss, chest pains when breathing in deeply. Next, we'll be talking about the treatments. There's no known cure for lupus, but there is medications that can be taken to treat lupus. So the first one is anticoagulants, anti-inflammatories, antimalarials, biologics, immunosuppressive steroids, non-steroidal anti-inflammatory drugs, and BLYS specific inhibitors. Next, we'll be seeing a short video on how it affects people's everyday living.
Attack self. In lupus, that attack can be on any organ system in the body, which makes it difficult to diagnose. It's a chronic disease. There's no cure. It tends to target women between the ages of 15 and 45, and women of color are 4 times more likely to develop lupus.
It's hard to live with. Imagine driving a car, but your taillights are out, your tires are going flat, your parking brake is engaged, you're leaking fuel, but yet you still have to figure out how to merge onto this interstate at a high speed. You have to still do it. That's what living with lupus is like.
It's hard to treat.
Lupus feels like you are in a boxing match and you are blindfolded with your hands tied behind your back and you're supposed to fight. How can you fight?
It's difficult to diagnose because every patient can look a little differently. There is no cure for lupus, but there are medications out there that can help treat the disease.
Lupus is hard, but you're not alone.
Alrighty, next. To conclude my presentation, lupus is an autoimmune disease where the immune system attacks healthy cells and tissues by mistake. which can damage many parts of the body like blood vessels, the heart, the skin, the kidneys, the joint, the brain. Women are more likely to get lupus. 9 out of 10 who are diagnosed are women, and they are women of color. There are no known causes of lupus, and there is no cure. And that concludes my presentation. Thank you so much. I hope you guys have a beautiful day.